A breech birth happens when a baby is born bottom first instead of head first. In a normal delivery, the baby's head comes out first. But in a breech birth, the baby's bottom, feet, or both might come out first. This happens in about 3 to 4% of all births. Breech births need careful management because they can pose risk to the baby during delivery. It's important to understand breech births so you can make informed decisions with your doctor. Breech births are categorized into 3 main types. Frank breech is when the baby's bottom comes first, with their legs up towards their head. Complete breech is when the baby is sitting cross-legged with their bottom first. Footling breech is when one or both of the baby's feet come out first. Each type of breech presentation may require different approaches during delivery. Understanding breech birth is not about causing worry, but about empowering expectant mothers. By knowing about breech birth, you can work with your healthcare provider to ensure a safe delivery for both you and your baby. Several factors can increase the likelihood of a baby being in a breech position. One common factor is prematurity. Babies born too early haven't had enough time to turn head down. Multiple pregnancies, where there's more than one baby in the womb, can also increase the chances of a breech presentation. This is because the babies have less space to move around. Other factors include issues with the placenta, such as placenta previa, where the placenta covers the cervix. Uterine abnormalities like fibroids or a differently shaped uterus can also restrict the baby's movement and lead to breech presentation. Too much amniotic fluid, known as polyhydramnios, allows the baby more freedom to move, potentially leading to a breech position. Understanding these risk factors helps you and your healthcare provider make informed decisions about your pregnancy and delivery. Early identification of potential issues allows for timely interventions and discussions about the best course of action for a safe birth. While not all breech presentations are preventable, some techniques might encourage your baby to turn head down. Gentle exercises, when approved by your doctor, can be beneficial. Pelvic tilts, where you tilt your pelvis forward and back, can help create space in your uterus. Forward-leaning inversions, done carefully and under guidance, might also encourage the baby to turn. Moxibustion, a traditional Chinese medicine technique, involves burning a specific herb near a specific acupuncture point. It's thought to stimulate the baby's movement. However, it's crucial to consult with a qualified practitioner before attempting moxibustion. Remember, every pregnancy is unique. What works for one woman may not work for another. It's always best to consult with your healthcare provider before starting any new exercises or therapies. Section 4. Positioning and posture during pregnancy. Maintaining good posture and body mechanics throughout your pregnancy can contribute to a more comfortable experience and potentially help your baby get into the optimal position for birth. As your belly grows, be mindful of your posture. Stand tall, keep your shoulders relaxed, and avoid slouching. Spending time on all fours or leaning forward, especially in your second and third trimesters, can create more space in your pelvis. This might encourage your baby to turn head down. You can try positions like sitting on an exercise ball or leaning over a counter. Listen to your body and avoid positions that cause discomfort or pain. Consult with your doctor or a physical therapist for personalized advice and exercises suitable for your stage of pregnancy and overall health. Section 5. Medical interventions for breech babies. If your baby remains in a breech position as your due date approaches, your doctor might suggest a procedure called external cephalic version, or ECV. ECV involves gently trying to turn the baby from the outside by applying pressure on your abdomen. It's usually done in a hospital setting with ultrasound guidance. The success rate of ECV varies, and it's not suitable for all pregnancies. Your doctor will consider factors like your health, the baby's position, and the amount of amniotic fluid. It's important to discuss the potential benefits and risks of ECV with your doctor to make an informed decision. Remember, ECV is a medical procedure and should only be performed by a qualified healthcare professional. It's crucial to have open communication with your doctor to address any concerns or questions you may have. Section 6. Seeking help and understanding labor options. If your baby remains in a breech position close to your due date, it's essential to discuss your delivery options with your healthcare provider. While some breech babies can be born vaginally, many healthcare providers recommend a cesarean section, or C-section, for breech presentations to minimize potential risks. A C-section is a surgical procedure where the baby is delivered through an incision in the abdomen. Your doctor will explain the procedure, risks, and benefits in detail. They'll also discuss pain management options and what to expect during recovery. Early intervention and close monitoring are crucial for breech pregnancies. By staying informed and proactive and by maintaining open communication with your healthcare provider, you can make informed decisions that prioritize the health and well-being of both you and your baby. Section 7. Conclusion: Your journey to a safe delivery. Navigating a breech pregnancy can feel overwhelming, but remember that knowledge is power. By understanding the causes, risk factors, and potential interventions for breech presentations, you can actively participate in decisions about your care. Open communication with your healthcare provider is paramount throughout your pregnancy journey. Remember, every pregnancy is unique. What works for one woman may not work for another. It's essential to have personalized guidance from your healthcare provider, who can assess your individual situation and recommend the best course of action. By staying informed, asking questions, and advocating for yourself and your baby, you can approach your delivery with confidence and a positive outlook. Your journey to motherhood is a remarkable one, and with the right support, you can overcome challenges and welcome your little one into the world safely.